Very commonly as a second line of treatment for people who have plantar fasciitis, we'll actually use a night splint. And the idea with the night splint is actually to keep the foot at approximately a 90-degree angle to the leg. And the importance behind this is that generally people who have plantar fasciitis have pain with initial rising out of bed in the morning. And what we do know is that by keeping the foot stretched out to the leg at night, it keeps the pain and what we call mechanoreceptors in the area of involvement stretched out at night. And it tends to help blunt and or reverse the pain in the inflammation cycle. The two general types of night splint that we commonly use would be an anterior night splint, which is a shell with Velcro closure that fits over the front of the ankle and attaches to the foot. And there's also a rigid, traditional, what we call posterior night splint. And the posterior essentially means it fits behind the leg and essentially holds the foot. Out of the two types of night splints that we generally use, either the anterior or the posterior night splint, anterior night splint generally is more tolerated by people who have plantar fasciitis under an active care plan, but both can very much effectively be used. So now we're demonstrating actually a patient applying the night splint. And essentially it's a Velcro and a buckle closure system, and the Velcro essentially is customizable or adjustable to your foot shape as it fits in into the brace, and it's a very simple closure system. The Velcro and the buckles essentially secure the foot at 90 degrees to the leg to help in treatment for plantar fasciitis. Now we're demonstrating the application of an anterior night splint used to treat plantar fasciitis. And the shell fits directly over the very front portion, or the anterior portion of the shin, and the sleeve slips over the forefoot or the metatarsal region, and the Velcro closure secures that foot at a close to 90-degree angle.